Nazi physicians and their assistants compelled inmates to participate in various devilish and fetish lab activities. Worse, the victims were not allowed to say no, and no consent was ever given for the procedures. The trials were typically carried out without anesthesia and ended in death, trauma, disfigurement, mutilation, or permanent handicap. In this video, we'll discuss the many atrocities that were regarded as medical experiments during the Nazi era. Before we begin, please subscribe and turn on the notification to keep seeing videos like this. Under the direction of General Edward Wirths, selected inmates were subjected to a variety of experiments to aid German military personnel in combat situations, develop new weapons, aid in the recovery of injured military personnel, and advance Nazi racial ideology and eugenics, i.e. Joseph Mengel's twin experiments. At Mauthausen, Albert Heim did similar medical experiments. Following the war, these crimes were tied in what became known as the Doctor's Trial. An outrage at the atrocities committed prompted the formation of the Nuremberg Code of Medical Ethics. In the Doctor's Trial, Nazi medics argued that wartime necessity justified their experiments, comparing their victims to collateral damage from Allied bombardment. Sigmund Rascher employed captives from the Dachau concentration camp in tests to help German pilots who had to eject at high altitudes in early 1942. These convicts were placed in a low-pressure chamber to replicate conditions at heights up to 68,000 feet. Rascher was said to have done vivisections on the brains of victims who had survived the initial experiment. 80 of the 200 subjects died instantly, while the rest were killed. The victim was smothered, as Rascher and another unnamed doctor recorded his reactions in a letter from April 5, 1942, to Heinrich Himmler. Before being murdered, the victim was described as a 37-year-old and in good health. Rascher detailed the victim's behaviors and timed the changes in behavior as he began to lose air. At 4 minutes, the 37-year-old began to wiggle his head. Rascher noticed that he was having cramps a minute later before falling unconscious. He explains how the victim was unconscious for 30 minutes after being deprived of oxygen, breathing only 3 times per minute. After that, the victim turned blue and began foaming at the lips. An autopsy was performed 1 hour later. Himmler ordered Rascher to continue the high-altitude tests and to continue testing on inmates sentenced to death to determine whether these men could be recalled to life, in a letter dated April 13, 1942. If a victim could be resuscitated, Himmler ordered him to be released from a lifetime concentration camp. At the Dachau concentration camp, tests were carried out from around July 1944 to roughly September 1944 to investigate various approaches to making seawater drinkable. All food was taken away from these victims, who were only given filtered seawater. A group of about 90 Roma were severely injured when Haas Ebinger denied them food and provided them with nothing to drink but seawater. Others saw them licking just mopped floors to get drinkable water since they were dehydrated. Regarding these seawater experiments in Dachau, a survivor named Joseph Schoenenig penned a statement. Schoenenig described how he learned about some of these tests conducted on inmates while working at the medical experimentation stations, including those in which they were made to drink salt water. Schoenenig also detailed how the experiment victims struggled to eat and frantically searched for any water source, even using floor rags. Schoenenig, who was in charge of operating the infirmary's X-ray machine, recalls how, despite knowing what was happening and its effects on the women, he was helpless to stop it. Sigmund Rascher tested the effects of polygol, a beaten apple pectin compound that promotes blood clotting. He asserted that taking polygol tablets regularly as a preventative measure will lessen bleeding from bullet wounds incurred in battle or after surgery. Polygol tablets, shots through the neck or chest, or amputations of the limbs without anesthesia were all administered to the subjects. The leader of the hygienic institution at Block 10 at Auschwitz, Bruno Weber, gave his subjects injections of blood types different from their own. The blood examined after this led to the congealing of blood cells. The Nazis frequently cut into a major artery when taking someone's blood, leading to significant blood loss and death. For the benefit of the German armed forces, studies in the Ravensbrück concentration camp were carried out from roughly September 1942 to roughly December 1943 to study bone, muscle, and nerve regeneration, as well as bone transplantation from one person to another. Patients were not given any anesthetic in these studies, as their bones, muscles, and nerves were removed. Many of the victims endured excruciating pain, mutilation, and long-term incapacity. Jadwiga Kamiska, a survivor, described how she underwent 2 operations at the Ravensbrück concentration camp in a deposition on August 12, 1946. Although she never claims to know the specifics of the procedures, she said that both times she had an operation on one of her legs, she was in excruciating pain and had a fever afterward, but received little to no post-surgical treatment. According to Kamiska, she was informed that she had undergone surgery merely because she was a young girl and a Polish patriot. She talks about how her leg continued to bleed pus for months following the surgeries. Experiments on twin children were conducted in concentration camps to demonstrate the superiority of inheritance over the environment in shaping phenotypes and to investigate ways to boost German reproduction rates. Joseph Mengele served as a primary experimenter and oversaw 1,500 sets of imprisoned twins from 1943 to 1944 at Auschwitz. Only 200 managed to survive. The twins were housed in barracks according to their sex and age in between trials that included amputations, illness infection, and dye injections to alter the color of the twins' eyes. He attempted to stitch identical twins together in another attempt, leading to gangrene and ultimately death. It was common practice to subject one twin to testing while keeping the other as a control. The second twin would be brought in and executed simultaneously if the first sibling perished during an experiment. Doctors would then compare the 2 bodies and examine the experiment's results. Mengele would dissect their bodies if the first twin lived. In another study, prisoners were left outside of the cold up to 6 degrees Celsius or 21 degrees Fahrenheit for several hours while completely naked. In addition to examining the physical impacts of exposure to cold, the experimenters evaluated several techniques for warming up survivors. A witness later said several victims were placed into hot water to rewarm them. Beginning in August 1942, prisoners at Dachau concentration camp were ordered to endure spending up to 3 hours in freezing water tanks. In a letter from September 1942, Rascher discussed a Dachau experiment on extreme chilling in which subjects were submerged in cold water while donning fighter pilot costumes. Because the German soldiers were unprepared for the cold weather they experienced, experiments on freezing and hypothermia were carried out for the Nazi High Command to mimic the circumstances the armies endured on the Eastern Front. The Germans proposed that the victims may be warmed by making them have sex with other victims under duress. An illustration was the positioning of a hypothermic victim between 2 nude Romani women. According to reports, these experiments caused the deaths of almost 100 people. After being purposely infected with tuberculosis at the Neuengamme concentration camp, the axillary lymph nodes of the victims were surgically removed. Later on, they were killed. A boy of 11 or 12 was shackled to a chair so he could not move in head injury experiments carried out in a tiny building behind the private residence held by a known Nazi ST security service member in Barnowicz, occupied Poland, in the middle of 1942. A mechanical hammer suspended above him dropped on his skull every few seconds. The torment rendered the child insane. Additionally, many inmates were subjected to injections that led to many diseases. Scientists tested vaccines and serums to prevent and treat contagious illnesses like malaria, typhus, tuberculosis, typhoid fever, yellow fever, and infectious hepatitis at the German concentration camps Sachsenhausen, Dachau, Natzweiler, Buchenwald, and Neuengamme. We have come to the end of this video. However, if you have any thoughts you'd like to share about these experiments suffered by inmates in Nazi camps, leave them in the comments section below. Please like this video, subscribe to our channel, and turn on the notification so you can keep seeing videos like this. See you in the next one.